better care is?
I'd like to call the attention of Mr. Jason Incabo, my colleague, because I'm electronically challenged, so I can't prove there. Is he? Please acknowledge. Bonjour, je parle un peu le français, mais je préfère parler anglais. Pardonne-moi. I do not know if you know anything about the new associated HIV infections. We call panic attack infection, which I'm suffering for about a week. Because prior to this conference, I had an email asking me to speak in this plenary, and I was trembling to death. And then I realized that it is my responsibility, and I said to the professor so nicely, yeah, I will take it, and I'm here. Second, this morning I was also bloody attacked with the traffic, so that's why I was late, sorry. Anyway, I am very pleased and honored to be here to your deliberations. It is my privilege and responsibility to share with you my concerns about better care. I would like to take this opportunity to thank all these people to whom I learned so much community care and support mobilizations. They highlighted what can be achieved, what can be done for care for those people living with HIV and AIDS. I had been asked today to provide an overview of a better care example from the front line. I should begin by thanking the organizers of the 6th International Conference of Home on Community Care for people living with HIV and AIDS. To our esteemed guests, fellow speakers, to our participants, advocates against HIV and AIDS, ladies and gentlemen, good morning to everyone. Much can be shared with you with regard to care issues surrounding HIV positive worldwide. Coming from a third world country whose resources continually depleted by the first world, we're always in constant search through a true light at the end of the tunnel. As one Filipino HIV positive said, I had been HIV positive for more than 8 years. Since my diagnosis, everyone is a battle. Every year is a battle. Every year, every step of the way is a frustrating event, making me so worried. My family, my relatives, my community, my doctors, my nurses, my government remain numb, and instead, I receive discriminations and stigma for this disease. With these realities, my society is helping me to isolate and alienate my personhood, my life. All I'm asking is simply care. That is such a simple word, and yet it's hard to understand. Our world has been confronted with enemy unseen, except the highly affected community. The impact of HIV and AIDS may be less visible than the graphic scene in September 11 attack, but the threat is equally alarming. And it has claimed and continues to take significantly more lives than terrorism-related incidences such as September 11, Bali, and Indonesia. AIDS has damaged the socio-political fiber and the economic activity of our young people. To date, the number of people living with HIV and AIDS in the world is more than 40 million, with adults of 37 million, and children under 15 years at 3 million. HIV is being transmitted to a person every minute worldwide. The epidemic is spreading into areas and countries where until recently there was a little no HIV present, including China, Indonesia, and Vietnam. With a combined of populations over 1.5 billion Asian people. Over 1 million people in Asia and the Pacific acquired HIV in 2003, bringing to an estimated of 7.4 million Asian people living with the virus. A further 500,000 people are estimated to have AIDS in 2003. But all of these figures give us a clearer pictures, cannot give us a clearer pictures of what lies before us. Scientists and advocates are now seeing the result of the values and social norms that are shaping the disease. In Asia and the Pacific, the cradle of the ancient world, social and cultural practices within an ambit of sexuality, masculinity, like myself, and behaviors predisposed or make people vulnerable to the disease. Now, let's talk about barriers to care. At this point, we may ask what makes care or better care inaccessible or unreachable. There are several reasons of the barriers, and they are as follows. Number one, stigma and discrimination create a false sense of security, undermines prevention efforts. Often stigma and discrimination build in existing prejudices and pattern of social inclusions by associating HIV and AIDS with groups of persons perceived as an outsider. People harbor the illusions that they themselves are not the risk of becoming infected. As a result, they may themselves to perpetrate risky behavior, such as unsafe sex. Because they believe that behaving differently would raise suspicion about HIV status. Second is the fear of discriminations in preventing people from seeking treatment and care for AIDS. People can be deterred from using voluntarily counseling and testing services, a linchpin of prevention, treatment, and care programs. Those living with HIV can be therefore be left isolated and deprived of the care and support that they could lessen the epidemic's impact. Even when seeking care and support, people infected with HIV can experience the harsh repercussions of stigma and discriminations. Those seeking of counseling may be rejected by the very service that it should help them, as our recent studies illustrate. Third is the lack of respect of human rights. Continues to increase vulnerability to HIV infections of individual and the whole society. Because our status, we had been denied of our civil, political, economic, social, and cultural rights. Further, gender inequalities spurs these realizations. However, care to progress has been happening. As an HIV-positive person, heading a care and support group of people living with HIV in the Philippines for several years now, it dawned upon me that HIV-related care is a vital, powerful investment that directly involves or benefits people living with HIV, thus reducing social and economic impact. Positive Action Foundation was created in 1998 avowed goal of providing care and support of people living with HIV and AIDS, and involvement of infected and affected communities in the programs. I would like to share with you some of my personal experiences. The progress of greater involvement of people living with AIDS in providing care in the Philippines. In 2002, we started a program to strengthen the role of people living with HIV and AIDS in the national response to HIV and AIDS in the Philippines. However, we triangulate three strategies of involvement approaches. One is networking. Why is networking? Because networking is one of the main integrationist activities. We focus on our interventions to introduce ourselves. It's my job. In both community and society, by taking part of the decision-making process in the national framework of the Philippine National AIDS Council. We work also extensively with the media, both television and print media. We have developed networking partnerships with international NGO in accessing generic ARV treatment through a treatment donation scheme with UNALS and Solidarité SIDA, a French NGOs, to provide ARV to some of our volunteers and project staff. Number two is the positive care. We have identified and recruited 30 PWA to be trained and HIV/AIDS health educators. Some had been trained as trainers of trainers to be accredited by the Department of Health. We collaborate with public hospitals. We assist the training of HIV/AIDS core team members in the hospitals. Our trained caregiver families are deployed to conduct counseling and in-home and hospital visits. We conduct regular support group meetings and peer education of PWHA family by addressing the pressing needs surrounding treatment and care, stigma and discriminations. Because I strongly believe that elimination of discrimination is everyone's concerns. We established 2 drop-in centers as temporarily shelters for PWA families, especially those residing from the provinces during their regular health monitoring in Manila. Community services take place on a regular basis. We have organized the first national consultation and consensus meeting of PWA in 2001, which resulted in adoptions of the Manila Manifesto that is crucial for our advocacy on access to treatment. In 2003, the second national consensus meeting was held, which included the families, the children, and children affected by the disease. Almost 300 people or participants have attended. Lastly is the access to treatment. With regard to treatment issues, Positive Action Foundation best achievement is the introduction of generic medications from CIPLA to the Philippines. We took the initiative to involve government agencies, because they are hard-headed, and other stakeholders of access to every generic treatment. Funds had been made available for purchasing ERV, and we have successfully also advocated for the inclusions of the ERV generic medication into the National Drug Formulary in the Philippines. We also use the ONGA's declarations, as what they said. We use this as a lobbying tool to remind the government of their commitments under the declarations. We is one of the most respected HIV/AIDS training educations in the Philippines. In 2003, April, for example, it was chosen as the Philippine HIV/AIDS only organization in the best integrated programs in Asia, as documented and published in Bangkok by the United Nations Economic Social Commissions of Asia Pacific, or UNESCO. With support from Solidarity SIDA, Union Aid Abroad, or AFIDA, Ford Foundation's Seduction. We undertake training on HIV/AIDS prevention of the Philippine migrant workers before they leave up to take contract work overseas. Driven by poverty of 10 million workers leave the Philippines each year to work overseas. Most male workers either go to the Middle East as construction workers, or seamen or mission shipping, usually under flags of convenience ships. Many Filipino women work overseas as domestic help in South and East Asia, countries such as Singapore, Hong Kong, and Japan. A significant number are also involved in the sex industry in Japan. We have an agreement with a large of contract hire firms that therefore departing for overseas Filipino workers, the migrant workers will first attend Positive Action Foundation run seminar on HIV/AIDS prevention. Over 40,000 workers, including seafarers, domestic household workers, and entertainers have been trained in the past 24 months. The staff of volunteers of Positive Action are innovative in their training and methods and use curricula which are simple and attractive. Enthusiastic and committed staff and volunteers deliver the training, and one measure for their effectiveness is the provision of first-hand experience, as many of them are HIV positive. Please. Now I challenge, ladies and gentlemen, I would like to challenge an advocate and participants here today to put up a teeth in the declarations of the commitment of the United Nations and declarations in 2001. I challenge fellow positive to start exchange and identifying what we need, what we require, and what we want so far as designing appropriate care. I challenge you, my brother, my sisters, in advocating our rights of healthcare and support without compromising the ideals and ideologies we believe in. I challenge international organizations to refrain from rhetoric. More action is needed to develop culturally sensitive intervention that will respond to the needs of HIV positive worldwide. I am a good representation of what is beyond the figures you make. I am what I am to make my life better and more meaningful and to live positively well.
Faites une conclusion, s'il vous plaît.
All I call nation today to hear us and will with us to achieve better call. Conclusion, today is the best preparation for tomorrow, to better care for people living with HIV and affected community. Good morning.